Hi everyone, Dr. David Kulla here with Synergy Wellness. So we have Marianne here and she complains of elbow pain, arm pain coming down one side. And I was explaining earlier that you have to determine whether or not it's tennis elbow or golfer's elbow, like an actual tendonitis in the elbow, or whether it's coming from her neck. She actually has both. So I did a video where I showed how we treat tendonitis, tennis elbow, or golfer's elbow with adjusting, Graston, and cold laser therapy. Right now, we're going to show you how we treat a pinched nerve. So if you have a pinched nerve and you get numbness or tingling radiating down your shoulder into your arm, hands, or fingers, or pain, it doesn't have to be numbness or tingling, it could be pain, it could be coldness, it could be burning sensation. There are many different sensations, but if it's abnormal, numbness, pins and needles, tingling, pain, shooting down your arm, something is wrong. And a lot of times people get it down their left arm, they think they're having a heart attack. Rightfully so, you may be. You should go get checked and make sure it's not a heart attack. In this situation, we know that's not what we're dealing with here. We're dealing with a pinched nerve in the neck, and oftentimes herniated discs can do that. So we have a couple of forms of traction here. We can do manual traction with a Y strap. We also have mechanical traction here, and then I can also do it by my hand. So there are many different ways to do traction. We're going to use the Y strap for her today. And this right here, this motion is going to help take pressure off that nerve in the neck and drop your head back. You going to be okay with those earrings?
Oh, no, not yet. Take them off.
Okay. And we're going to go ahead and traction out the neck. And what this does is it opens up the disc space, and it also opens up the foramina where the nerve exits, allowing the nerve more room to breathe without being chafed or irritated by inflammation or soft tissue damage in the area. So we do a light pull here. How are we doing there? Okay.
That's good. Yeah.
And another indicator that it's a pinched nerve in the neck is if you pull the neck out or away and it feels better for the patient, that's a good sign it's also coming from the neck, not from the elbow. And then the other indicator would be if I let go of this and it brings her neck back in and it hurts and the pain increases, that's another indicator that we're dealing with a disc herniation or a pinched nerve in the neck. And does that hurt when I let it go and bring it back in?
No.
Okay. Right now, she's not in acute pain, but last week or 2 weeks ago, when we did this and we let this go and brought it back in, she had pain. It increased the pain in your neck. I don't know if you remember that. Now she's doing much better. She doesn't have as much acute nerve pain. And we want to do a nice steady pull, not too strong. Good. And gently lift your head.
Okay.
And drop it back. And you want to make sure that you don't pull that too strong. If somebody has a herniated disc and it's a lateral herniation, it could certainly aggravate the condition. So you want to be careful about that. Now what we're going to do is check her neck and just do a little bit of stair stepping to get the facet joints gliding a little better. So this stair stepping motion is like a figure 8 at every level. It's a very small movement. Okay, cross your arms in front of you.
No, I don't.
You don't want to do that one in between the shoulder, but it's okay. Turn over on your stomach. We could do that differently.
Okay.
So we were going to do an adjustment, an anterior adjustment in between your shoulder blades. She doesn't like that adjustment so much. So we're going to do it a little differently here. Okay, we're going to use an activator to adjust her neck. And we're just going to loosen up these muscles in here. You had winced a little bit in pain. Was it your back or your neck?
It's the pressure from that thing you was doing.
Okay. Okay, slide up a little bit. So with her neck is very stiff and there's a lot of arthritis in there. So we're going to adjust her neck face down. This is a different way to adjust the neck. Some people don't like their neck cracked, and she's one of them. Relax here. Okay, you're all set.
Okay.
If you have any questions or comments about a disc herniation in the neck, a pinched nerve in the neck, or a tennis elbow, feel free to comment below. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.